Are these ostensibly healthy fruits covertly detrimental to your health? Have you ever consumed a fruit, assuming it was a nutritious choice, only to later realize it may be insidiously harming your body? Consider this. You have been consuming a particular fruit daily, convinced it is rich in vitamins and antioxidants. However, what if I informed you that this very fruit could be elevating your blood sugar, compromising your kidney function, or even interacting adversely with your medications? This is not merely an isolated incident. It is an issue many seniors inadvertently encounter. Certain fruits, while appearing innocuous, may pose significant health risks. Seemingly innocuous fruits can pose significant health risks for older adults, particularly those with diabetes, heart disease, or kidney issues. Today, we will reveal 6 misleading fruits that may appear beneficial but could, in fact, be detrimental to your health. I will elucidate the reasons for their potential dangers, their effects on the body, and how to consume fruit safely without compromising your well-being. It is crucial to note that many seniors are unaware of these risks until it becomes too late. Certain fruits can precipitate unforeseen health crises, ranging from dizziness and confusion to more severe conditions such as kidney failure or cardiac complications. Real narratives, genuine risks. Consider John, a 72-year-old retiree who valued his healthy lifestyle, engaging in daily walks, consuming ample water, and maintaining a diet abundant in fresh fruits and vegetables. One day, he encountered a vibrant tropical fruit in the grocery store. Believing it to be an enjoyable and nutritious enhancement to his morning smoothies, he began to incorporate it into his daily diet. Initially, everything appeared satisfactory. However, he soon began experiencing dizziness, cognitive impairment, and profound fatigue. One morning, he awoke in a state of complete disorientation. His family promptly transported him to the hospital, where physicians determined that the fruit he had consumed had poisoned his system. It was revealed that John had mild kidney disease, a condition of which he was previously unaware. The fruit he believed was beneficial was, in fact, inundating his body with a toxin that his kidneys could not process, resulting in a perilous accumulation that impacted his nervous system. This scenario could occur to anyone. Therefore, I urge you to view this video in its entirety, as the insights you gain today may assist you in circumventing a significant health concern and maintaining vitality for years ahead. You will discover 6 unexpected fruits that may jeopardize your health, identify those most susceptible and the reasons for their increased risk, and understand why seniors should exercise heightened caution. Additionally, I will present intelligent alternatives that allow you to relish delectable and safe fruit without the concealed hazards. Before we proceed, please do me a favor and click the like button if you find this information beneficial. Assists more seniors in uncovering vital health advice such as this. If you have not yet subscribed, please do so and activate notifications to ensure you do not miss any significant updates. Let us commence, as fruit should provide nourishment rather than pose risks. The concealed perils of starfruit serve as a crucial alert for seniors. John's experience is not an isolated incident. It serves as a grave caution regarding the misleading nature of certain fruits, particularly for seniors. He is not the only one affected. The National Kidney Foundation has raised concerns. Even a modest portion of starfruit, consisting of merely a few slices, can be. Kidney disease poses a life-threatening risk to seniors with diminished renal function. To contextualize, 1 in 3 adults over the age of 65 is afflicted with some variant of kidney disease, as reported by the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. The critical issue is that many individuals remain unaware of their condition, as kidney disease often manifests without immediate symptoms. It can insidiously advance for years until an external factor, such as starfruit, exacerbates the situation and precipitates a severe health crisis. Even if one feels entirely well and presumes their kidneys are functioning optimally, this may not be the case. There is a significant possibility that they are not filtering toxins as efficiently as necessary, rendering the consumption of starfruit a precarious choice. The impact of starfruit on the body involves a perilous chain reaction. Specifically, when koroxin, the concealed toxin in starfruit, accumulates in your system, it is not merely a benign substance. It is a neurotoxin. Koroxin does not remain inert in the body. It actively assaults the nervous system. The manifestations may include dizziness, confusion, lightheadedness, and difficulty concentrating. Experiencing cognitive impairment is the initial indication that something is amiss. The toxin interferes with neural signaling, resulting in a sense of instability and mental lethargy. Profound fatigue ensues as the body grapples with the toxin, depleting energy reserves and rendering even mundane tasks arduous. Cognitive deficits, such as those encountered by John, may manifest as short-term memory loss, leading to confusion or disorientation in routine activities. In extreme instances, carboxin may hyperstimulate the nervous system, precipitating uncontrollable seizures. Coma and critical organ failure may also occur. Failure to address extreme buildup can result in starfruit poisoning, potentially leading to coma or death, as documented in various medical studies, including those published in the Clinical Journal of the American Society of Nephrology. In addition to neurological complications, renal overload must be considered. When kidneys fail to filter out toxins, these substances actively harm the body, potentially resulting in acute kidney injury and transforming a mild condition into a severe crisis. One may question why seniors continue to consume starfruit despite its associated risks. The answer lies in its appealing attributes: a vibrant yellow hue, distinctive star shape, and invigorating tropical flavor. It is low in calories, rich in vitamin C, and abundant in antioxidants, qualities that align with a health-conscious diet. Frequently promoted as a superfood, it is easy to perceive it as a safe option. However, for seniors with impaired kidney function, this seemingly healthy choice may pose significant dangers. Safer alternatives exist for enjoying tropical flavors. Flavors without risk. The positive aspect is that you need not forego tropical flavors entirely. You merely need to make judicious choices. Here are some delectable kidney-friendly options that allow you to savor the essence of the tropics without peril. Asian pears are crisp, juicy, and inherently sweet, offering a comparable texture to starfruit without the associated toxicity. Additionally, they are abundant in fiber and vitamin C. Dragon fruit, equally exotic as starfruit, features a striking pink exterior and speckled flesh. It is entirely safe and nutrient-rich. Mangoes, sweet and succulent, are rich in antioxidants and provide a delightful tropical experience without concealed hazards. Papayas, characterized by their buttery texture and abundant vitamins A and C, present all the allure of tropical fruits without posing any risk to renal health. Both fruits offer a refreshing exotic flavor while safeguarding your well-being. Ultimately, the question arises, should one take the risk of consuming starfruit? Food ought to be a source of nourishment and pleasure, not an unrecognized health threat. Starfruit may present such a risk. Starfruit may appear alluring on the shelf due to its glossy finish and exotic allure. However, for seniors, particularly those with renal complications, it poses an unwarranted risk. The likelihood of experiencing dizziness, confusion, seizures, or more severe consequences far surpasses any nutritional advantages. Therefore, when you encounter starfruit at the grocery store, reconsider your choice. Opt for a safer alternative to ensure the well-being of your kidneys and nervous system. Grapes, on the other hand, present a hidden danger as a sugar trap and a potential choking hazard. Patricia sat in her physician's office. Patricia felt bewildered and exasperated in the office. She believed she had made prudent dietary choices by replacing cookies and candy with a bowl of fresh grapes. However, the reality struck her forcefully when her doctor reviewed her latest blood sugar reading of 180 milligrams per deciliter, significantly higher than her typical range of 100 to 120 milligrams per deciliter. His immediate response was, "It's the grapes." Patricia was incredulous. How could something so natural and seemingly innocuous elevate her blood sugar more than certain processed foods? Research from Harvard Medical School indicates that grapes possess a high glycemic index, potentially causing a more rapid increase in blood sugar levels than whole grain bread, particularly in seniors whose glucose regulation has diminished. This transforms a seemingly healthy snack into a concealed health risk. Additionally, grapes pose a latent choking hazard for the elderly. Consider the last instance you absent-mindedly consumed a grape. Engaging in activities such as watching television, reading, or consuming a snack can pose risks. Consider the scenario where food becomes lodged in the airway. For younger individuals, a brief cough may suffice to expel the obstruction. However, for seniors, this situation can escalate into a life-threatening emergency within moments. The often ignored peril of dysphagia arises as we age, leading to diminished swallowing reflexes. The coordination of throat muscles deteriorates, and the gag reflex becomes less responsive. According to a report from the National Safety Council, choking incidents involving grapes are particularly prevalent among the elderly. Incidents have increased by 30% over the past 5 years. This is attributable to the characteristics of grapes, which are small, round, smooth, and slippery, ideal for obstructing an airway if ingested whole or inadequately chewed. Once lodged in the throat, their slick exterior complicates dislodgement, even with the Heimlich maneuver. Imagine this scenario. You are enjoying an evening performance while casually snacking on grapes. One slips down before you have properly chewed it, abruptly obstructing your breathing. You attempt to cough, but nothing dislodges. Panic ensues. If no assistance is present, this situation could become fatal within minutes. Disturbing. Completely avoidable 100% how to relish grapes without jeopardizing your health. Does this imply that you must eliminate grapes from your diet indefinitely? Not necessarily, but strategic consumption is essential. Here are methods to enjoy grapes safely without endangering your blood sugar or respiratory health. Cut them into quarters. Always slice grapes into quarters prior to consumption. This significantly diminishes the choking risk and compels slower eating, thereby aiding in the prevention of blood sugar surges. Pair them wisely. Combine grapes with protein or healthy fats, such as a cube. A handful of almonds or Greek yogurt, along with cheese, mitigates sugar absorption and aids in preventing energy crashes. Monitor your portions. Restrict yourself to a maximum of 6 small grapes at once, approximately half a cup, to satisfy your craving without overloading your system. Consider safer, senior-friendly fruit alternatives. If you are willing to diversify, here are some delectable, low-risk options that provide flavor and nutrition without causing sugar spikes or choking hazards. Fresh berries such as strawberries, blueberries, and raspberries. Melons, including watermelon, cantaloupe, and honeydew, are lower in sugar, abundant in antioxidants, and possess a soft texture that facilitates easy chewing. These fruits are naturally sweet and hydrating, presenting a reduced likelihood of complications compared to grapes. Apple slices paired with nut butter serve as a fiber-rich alternative that aids in blood sugar regulation while delivering a gratifying crunch. Peeled peaches or nectarines are also naturally sweet, easier to chew, and lower on the glycemic index. Ultimately, one must consider whether grapes are worth the potential risk. Despite their seemingly innocuous appearance, they represent a classic case of caution for seniors. Caution: the sugar content is higher than anticipated, potentially causing a significant spike in blood sugar levels. The risk of choking is considerably greater than most individuals recognize. A single misstep could result in a medical emergency. However, by consuming grapes judiciously, such as slicing them, controlling portions, and pairing them with appropriate foods, you can still relish grapes without jeopardizing your health. Were you aware of these concealed risks? Please share your thoughts in the comments below. If you find these insights beneficial, kindly click the like button. This initiative disseminates vital information to a broader senior audience. Subscribe and activate notifications to ensure you receive every health tip that could significantly impact your well-being. Now, let us proceed, as grapes are not the sole nutritious fruit with concealed hazards. Oranges present hidden risks associated with this seemingly healthy citrus. Margaret's experience serves as a cautionary tale for seniors grappling with acid reflux, recurrent burping, or gastrointestinal discomfort. She endured years of chronic heartburn, mistakenly believing it was merely an inevitable aspect of aging. She attempted. Despite utilizing antacids, dietary modifications, and even prescription medications, she found no enduring relief. Almost serendipitously, she ceased consuming oranges, leading to a significant improvement in her symptoms within days. The underlying issue was the high acidity of oranges, which had been exacerbating her digestive condition. Acid reflux, or gastroesophageal reflux disease, GERD, is alarmingly prevalent among seniors, with over 60% of adults over 60 affected, according to the GERD Foundation. Notably, oranges are a contributing factor. Citrus fruits are among the primary triggers for acid reflux due to their high acidity. They stimulate the production of stomach acid, exacerbating the frequency and severity of reflux episodes. Additionally, acid compromises the integrity of the esophageal sphincter, the muscle responsible for retaining stomach acid. When this muscle relaxes excessively, acid can regurgitate into the esophagus, resulting in painful heartburn. Numerous seniors report nocturnal awakenings caused by acid reflux, often unaware that their morning orange juice may be the culprit. Margaret's experience is not isolated. Millions of seniors face similar issues. Individuals may inadvertently exacerbate their acid reflux by consuming oranges. Furthermore, oranges can disrupt the efficacy of medications, a risk that is often overlooked beyond gastrointestinal complications. For seniors, oranges pose an additional significant threat as they can interact with over 50 commonly prescribed medications. According to the Mayo Clinic, oranges and orange juice can inhibit essential enzymes responsible for drug metabolism, potentially compromising the intended effects of medications and jeopardizing health. Here are a few examples. Examples of blood pressure medications, such as atenolol and phentolamine, frequently prescribed for hypertension, may exhibit diminished efficacy when consumed with orange juice. Cholesterol-lowering statins, including simvastatin, intended to mitigate heart disease risk, may not function optimally when combined with oranges. Certain antidepressants, particularly SSRIs like sertraline, can be less effective, complicating mood regulation. Consider this scenario. You take your blood pressure medication each morning, assured that it maintains stable levels, yet a glass of fresh orange juice may be quietly diminishing its efficacy, placing you at risk for perilous elevations in blood pressure. For seniors reliant on medications for health maintenance, this covert interaction poses a significant concern. Additionally, oranges can adversely affect tooth enamel, as the acid can compromise dental integrity. As we age, tooth enamel naturally thins, and acidic foods exacerbate this erosion, rendering teeth more susceptible to sensitivity, pain, or discomfort. Consuming hot, cold, or sweet foods heightens the risk of cavities, as weakened enamel facilitates decay. Gum irritation may occur, with acid inflaming sensitive gum tissue, resulting in soreness and discomfort. For seniors with already compromised enamel, the high acidity in oranges can be particularly detrimental. To enjoy citrus without harming your teeth, consider the following. Drink a glass of water afterward to neutralize the acid. Use a straw when consuming orange juice to minimize direct contact with teeth, and wait 30 minutes before brushing, as immediate brushing can exacerbate the issue. Consuming acidic foods shortly after ingestion can exacerbate erosion. Therefore, the most prudent strategy is to significantly reduce the intake of oranges, particularly if you experience acid reflux, take daily medications, or have sensitive teeth. Safer alternatives exist for obtaining vitamin C without associated risks. If you are concerned about lacking vitamin C, rest assured there are numerous milder options that provide equivalent immune-boosting advantages without the acidity. For instance, red bell peppers contain a higher concentration of vitamin C than oranges while exhibiting considerably lower acidity. Slice. Consume them as a snack or incorporate them into a salad. Kiwis are a sweet, tangy fruit abundant in nutrients without excessive acidity. Strawberries are a low-acid fruit that can be easily added to yogurt or oatmeal or enjoyed independently. Broccoli and Brussels sprouts are nutritional powerhouses, offering vitamin C and various health benefits. These selections are gentler on the stomach, teeth, and medication regimen, rendering them suitable for seniors aiming to maintain health. How to safely consume oranges if abstaining is not an option. It is difficult to envision life without them. Oranges need not be entirely excluded from your diet. Rather, exercise prudence in their consumption. Timing is crucial. Consume oranges during midday instead of immediately upon waking or before sleep to mitigate digestive complications. Be mindful of your medications. Allow a minimum of 2 hours post-ingestion of pharmaceuticals before consuming citrus to prevent interference. Dilute the juice by mixing orange juice with water in a 1-to-1 ratio to decrease acidity and alleviate strain on your stomach and dental health. Achieve balance by pairing oranges with alkaline foods such as bananas or avocados to neutralize acidity. Regarding acidity, while these strategies may mitigate risks, they do not eliminate them entirely. For seniors, particularly those with acid reflux, medication requirements, or dental issues, complete avoidance of oranges may be the most prudent choice. In conclusion, are oranges beneficial or detrimental for seniors? Despite their appealing appearance and reputation for being nutrient-rich, oranges can pose significant challenges for older adults. They can provoke acid reflux, disrupt essential medications, and contribute to the erosion of tooth enamel. For many seniors, the disadvantages outweigh the advantages. By comprehending these risks and investigating safer alternatives, you can make decisions that genuinely enhance your health. Therefore, the next time you consider consuming an orange, reflect on whether it is worthwhile or if a bell pepper or kiwi would be more suitable for your later years. I invite your feedback. Did any of these risks astonish you? Please leave a comment below. If you find these insights beneficial, kindly click the like button to assist more seniors in accessing these essential health tips. Subscribe and activate notifications. You should not overlook any video that may assist you in achieving a longer, healthier life. Now, let us proceed, as the subsequent fruit on our list may be even more surprising. More intelligent methods to consume avocados while mitigating risks. Does this imply that you must completely eliminate avocados from your diet? Not necessarily, but it is essential to be cognizant of their role in your diet, particularly as you age. If you are fond of avocados, here are strategies to incorporate them into your meals without compromising your health. First, monitor your portions. Be vigilant about calorie intake. Recall Robert, the 75-year-old retiree who inadvertently gained 12 pounds in 3 months by incorporating avocado toast into his diet, illustrates the importance of portion control. Limit servings to a quarter of an avocado, approximately 60 calories. Avoid additional ingredients such as olive oil, cheese, or spreads, as avocados are inherently high in fat. Achieve dietary balance by pairing avocados with lean proteins, such as grilled chicken or eggs, and fiber-rich vegetables to prevent overeating. While avocados are not detrimental, excessive consumption can be harmful. Additionally, review your medications. Could avocados be a factor? Interfering with your medications. Are you consuming blood thinners, antihypertensives, or antidepressants? If so, avocados may be compromising their efficacy without your awareness. Blood thinners, such as warfarin, Coumadin, are impacted by avocados' high vitamin K content, which can counteract their effects and elevate your risk of thrombosis. Regarding antihypertensives, the healthy fats in avocados may influence the absorption of specific hypertension medications, resulting in erratic blood pressure readings. For antidepressants, selective serotonin reuptake inhibitors, SSRIs, like citalopram, may also be affected. Certain compounds in avocados may modify the absorption and metabolism of specific medications, potentially diminishing their efficacy. Solution: prior to incorporating avocados into your daily regimen, consult with your physician or pharmacist to ensure they will not interact adversely with your medications. Additionally, be cautious of late-onset allergies, which can manifest at any age. It is a misconception that one cannot suddenly develop an allergy to avocados after a lifetime of consumption. As we age, our immune system undergoes changes, allowing for the emergence of new allergies. Individuals in their 60s, 70s, or even 80s may experience latex fruit syndrome, a concealed allergy. If one possesses a sensitivity to latex from gloves, balloons, or medical supplies, they may also exhibit an allergy to avocados. Symptoms encompass an itchy mouth or throat, swelling of the lips or face, digestive discomfort, nausea, cramping, bloating, and skin irritation following contact with an avocado. This phenomenon occurred with Margaret, a 72-year-old resident of Phoenix, who had relished avocados for decades, but suddenly began to suffer from a scratchy throat and tingling lips each time she consumed them. Initially, she attributed her symptoms to a new salad dressing. However, after experiencing recurrent reactions, she consulted an allergist. The diagnosis revealed a newly developed avocado allergy. Recommendation: if you encounter any atypical reactions after consuming avocados, undergo testing for food allergies. Explore alternatives, as numerous healthy fats exist that do not provoke allergic responses. For those who appreciate the creamy texture and heart-healthy fats of avocados, but seek lower-calorie, lower-risk substitutes, consider these safe alternatives. Nuts. Almond or cashew butter, rich in healthy fats, allows for easier portion control compared to avocados. Walnuts and flax seeds are abundant in omega-3 fatty acids, beneficial for brain and cardiovascular health. Olives and olive oil provide similar monounsaturated fats in smaller, manageable portions. Hard-boiled eggs serve as a high-protein, nutrient-dense alternative that is low in calories, yet satiating. These substitutions offer heart health advantages without excessive caloric intake or medication risks. How to consume watermelon safely without the health risks associated with watermelon consumption do not imply that seniors must entirely forego this fruit. However, the manner of consumption significantly influences its effects. If you relish watermelon but wish to prevent blood sugar surges, cardiovascular strain, and renal overload, consider the following guidelines for safe enjoyment. First, monitor your portion sizes. Moderation is key. Although watermelon comprises 92% water, excessive intake can burden your system, particularly for seniors with diabetes, kidney complications, or heart conditions. Limit your consumption to half a cup per serving. Consume approximately 1 handful of diced watermelon rather than overloading your plate. Restrict your intake to 1 serving per day to avert blood sugar fluctuations and fluid retention. Refrain from consuming watermelon at night to mitigate nighttime swelling and respiratory complications. Recall Betty, who believed that eating watermelon every afternoon constituted a healthy practice until she was hospitalized due to significant swelling and respiratory issues. For seniors, portion control is paramount. It is prudent to moderate the sugar influx. Watermelon possesses a high sugar content. The glycemic index, GI, indicates that watermelon can elevate blood sugar levels as rapidly as a can of soda. However, one can mitigate this sugar surge by pairing watermelon with protein or healthy fats, such as a handful of nuts, seeds, or Greek yogurt. Consuming it alongside fiber-rich foods like chia seeds, flax seeds, or whole grain crackers can enhance digestive balance. It is advisable to avoid consuming watermelon on an empty stomach, as this accelerates sugar absorption and exacerbates subsequent crashes. For instance, rather than consuming a large bowl of watermelon alone, consider having a few cubes accompanied by almonds or cottage cheese. Assists in decelerating digestion, thereby averting abrupt fluctuations in blood sugar levels. Exercise caution if you are prescribed diuretics, commonly referred to as water pills. If you are utilizing diuretics for hypertension or heart failure, watermelon may counteract your medication unbeknownst to you. Diuretics expel excess water from your body, aiding in the prevention of fluid accumulation, edema, and elevated blood pressure. Conversely, watermelon inundates your system with water, potentially negating the efficacy of your medication. This may result in perilous complications, including fluid retention. Consult your physician prior to incorporating watermelon into your daily regimen if you are on diuretics or managing cardiac conditions or potassium levels. A concealed risk for elderly individuals with renal complications is that many are unaware of watermelon's high potassium content. For seniors with kidney disease, this poses a significant threat, as compromised kidneys may struggle to eliminate excess potassium, leading to accumulation in the bloodstream and resulting in arrhythmias. In extreme instances, this can precipitate cardiac arrest, muscle weakness, and cramps. Excessive potassium can impair nerve function, leading to confusion and fatigue. Elevated potassium levels may adversely affect cognitive function. Notably, the National Kidney Foundation indicates that 40% of adults over 65 exhibit some degree of kidney dysfunction, frequently without awareness. Consequently, regular consumption of watermelon may strain your kidneys. Recommendation: if you have kidney issues, restrict watermelon intake to small portions or choose lower potassium fruits such as apples or berries. Consult your physician to assess your potassium levels if necessary. Frequent consumption of watermelon presents 5 safer alternatives. Hydrating fruits devoid of associated risks. If you desire the hydration and sweetness of watermelon without the blood sugar spikes, excessive potassium, or fluid retention, consider these senior-friendly substitutes. Cucumber slices, equally hydrating as watermelon but lacking in sugar. Frozen berries, a low glycemic index, high antioxidant option that will not elevate blood sugar levels. Cantaloupe or honeydew, comparable to watermelon yet lower in sugar and potassium. And infused water, enhanced with a splash of flavor. Watermelon juice, infused with mint and ice, offers flavor without associated risks. These alternatives maintain hydration without imposing additional stress on the heart, kidneys, or blood glucose levels. In conclusion, seniors may consume watermelon, but only in limited, regulated portions. Caution is advised for individuals with kidney disease, uncontrolled diabetes, or those on diuretics. While watermelon is not inherently detrimental, it necessitates careful moderation for seniors. Excessive consumption can result in edema, elevated blood sugar, and cardiovascular complications. It is advisable to pair it judiciously, as solitary consumption may induce sugar spikes. Consultation with a healthcare professional is recommended. Consult a physician, particularly if you're on diuretics or suffer from renal disease. For numerous seniors, the risks surpass the advantages. Therefore, before indulging in a slice of watermelon, consider whether it is truly worthwhile, or if a handful of frozen berries or cucumber-infused water would be a more prudent option for your later years. Did any of these risks astonish you? Please leave a comment below to share your thoughts. If you find this information beneficial, kindly click the like button to assist in disseminating this vital knowledge to more seniors. Subscribe. Activate notifications to ensure you do not overlook any video that may assist you in achieving a longer, healthier life. Now, let us proceed, as the subsequent fruit on our list may be even more surprising. Papayas, the digestive superfruit that could be covertly inducing significant health problems. Watermelon, the quintessential summer delicacy, may pose risks to your health. What if I informed you that your beloved seasonal fruit could be causing more harm than benefit? Watermelon is emblematic of summer, juicy, refreshing, and replete with water. Watermelon, an ostensibly ideal snack for hydration, may pose a covert risk to the cardiovascular system, renal function, and glycemic levels in seniors. Indeed, this seemingly innocuous fruit could jeopardize health. Let us elucidate the reasons behind this potential danger and the necessary precautions. Firstly, the hydration dilemma. Can excessive water intake be detrimental? Comprising 92% water, watermelon serves as a hydration enhancer. However, as we age, our kidneys become less efficient at filtering fluids. Efficiently as they once did, the body now retains fluid dangerously. What implications does this have for seniors? Swelling may occur in the ankles, hands, and face, accompanied by shortness of breath. This extra pressure against the lungs complicates respiration and elevates blood pressure, causing the heart to exert more effort, potentially leading to heart failure. Consider the case of Betty, who consumed watermelon every afternoon and later observed swelling in her legs. She awoke, gasping for air, and was promptly taken to the hospital, where doctors uncovered that her health was compromised. The consumption of watermelon has precipitated significant fluid retention, posing a genuine risk for the elderly. Individuals with cardiovascular issues, hypertension, or renal complications may find excessive watermelon consumption perilous. Additionally, watermelon contains concealed sugars, comparable to those found in a can of soda. Many do not perceive watermelon as a high-sugar fruit. However, it can elevate blood sugar levels more rapidly than anticipated. For instance, 2 cups of watermelon contain 18 grams of sugar, nearly equivalent to that in a small soda. This presents a substantial concern for seniors with diabetes or prediabetes. Upon consumption, watermelon induces a rapid increase in blood sugar levels, followed by a subsequent decline. This fluctuation can lead to mood swings and cognitive impairment, resulting in irritability, forgetfulness, and lack of focus. Even in the absence of diabetes, frequent blood sugar spikes heighten the risk of insulin resistance, thereby increasing the likelihood of developing type 2 diabetes. To mitigate these effects, it is advisable to consume watermelon in moderation, limiting portions to half a cup per serving. Pairing it with protein or healthy fats, such as a handful of nuts, Greek yogurt, or cheese, can help moderate blood sugar responses. Additionally, it is prudent to avoid consuming watermelon on an empty stomach to prevent abrupt spikes in blood sugar levels. A surge in potassium levels poses a significant risk, particularly for seniors with kidney disease. While bananas are commonly recognized as a potassium-rich fruit, watermelon also contains substantial amounts of potassium. When kidneys fail to filter excess potassium, it can lead to irregular heartbeats, disrupted heart rhythms, weakness, and fatigue. Symptoms such as shakiness, tiredness, or lightheadedness may indicate heart failure, and elevated potassium levels can precipitate cardiac arrest. Alarmingly, the Kidney Foundation reports that 40% of adults over 65 are affected. Many individuals with kidney dysfunction remain unaware of their condition. If you have kidney disease, consuming watermelon may silently elevate your potassium levels, thereby jeopardizing your cardiovascular health. Additionally, the combination of watermelon and certain medications can be perilous. For those taking diuretics, commonly prescribed for hypertension or heart failure, watermelon may disrupt the efficacy of the medication. Diuretics eliminate excess fluid from the body to mitigate swelling and high blood pressure, while watermelon inundates your system with water, potentially leading to hazardous consequences. Fluid accumulation resulting in edema, respiratory difficulties, and cardiac strain. Solution: consult your physician. Incorporate watermelon into your daily regimen. Monitor your edema and respiratory function. If necessary, reduce watermelon consumption promptly. Consider 5 healthier alternatives. Enjoy hydration without associated risks. If you appreciate watermelon but wish to avoid blood sugar surges, cardiac stress, or renal overload, opt for safer alternatives such as cucumber slices, which contain no sugar or excessive potassium, frozen berries, which are low in sugar and high in antioxidants, or cantaloupe and honeydew. Watermelon-infused water contains lower levels of sugar and potassium compared to watermelon juice with mint and ice, presenting fewer health risks. These alternatives provide refreshment without jeopardizing health. In conclusion, seniors should consume watermelon, but only in limited, controlled portions. For individuals with kidney disease, uncontrolled diabetes, or those on diuretics, watermelon may appear innocuous. However, it poses significant risks for seniors, potentially leading to edema, elevated blood sugar, and cardiovascular complications. It is advisable to pair watermelon judiciously and avoid consuming it in isolation. Consult your physician, particularly if you have renal disease or are on medication. Papaya, often regarded as a superfood for digestion, is believed by many seniors to enhance gut health, mitigate inflammation, and promote regularity. However, this purported digestive panacea may not be a benign option for older adults. In fact, for certain individuals, it can provoke hazardous drug interactions and allergic responses. Stomach irritation can subtly compromise your health. It is essential to elucidate why seniors must exercise heightened caution when incorporating papaya into their diet. One significant concern is potential drug interactions. Could papaya be diminishing the efficacy of your medications? If you are prescribed blood thinners, diabetes medication, or antibiotics, papaya may be interfering with their effectiveness unbeknownst to you. According to the FDA, papayas contain papain, a digestive enzyme that can alter the absorption and processing of medications in your body. This indicates that your prescriptions may not function as intended or could potentially become hazardous. The risks associated with blood thinners, such as warfarin, are heightened by papaya, which amplifies their effects, resulting in excessively thin blood. This escalates the risk of severe bleeding, even from minor injuries. Regarding diabetes medications, papaya may induce a rapid decline in blood sugar levels, resulting in dizziness, confusion, weakness, and even syncope. Certain antibiotics may also be metabolized differently in the presence of papaya, diminishing their efficacy. Helen, a 71-year-old resident of San Diego, began consuming papaya daily after learning of its purported digestive benefits. Within weeks, she observed a decline in the efficacy of her blood pressure medication, experiencing lightheadedness and weakness. Concerned, she consulted her physician, who inquired about her dietary habits. Upon learning of her papaya consumption, the doctor promptly suspected a food-drug interaction. Indeed, after eliminating papaya from her diet, her blood pressure returned to stability. The conclusion: individuals on daily medications should consult their physician prior to incorporating papayas into their routine. there exists a notable allergy risk associated with papaya. Individuals with a latex allergy may experience adverse reactions upon consuming papaya, as it contains proteins closely resembling those found in latex, a phenomenon referred to as latex fruit syndrome. Consequently, if you are allergic to latex gloves, balloons, or bandages, ingesting papaya could provoke a reaction. Symptoms indicative of a papaya allergy include an itchy mouth, swelling, tingling, or burning sensations in the lips, tongue, or throat, as well as skin reactions such as rashes, hives, or itching following contact with papaya. Respiratory issues may also arise. In severe instances, latex allergies can induce wheezing or even anaphylaxis, a life-threatening reaction. Alarmingly, these allergies may manifest later in life, even after previously consuming papaya without issue. Margaret, a 72-year-old from Phoenix, had enjoyed papaya for years. However, one day after eating her customary papaya salad, she experienced tingling in her lips and a scratchy throat. Initially, she attributed it to a spice in the dressing, but after a recurrence, she consulted an allergist who diagnosed her with a latex allergy. Sensitivity rendered papayas prohibited. Lesson learned: if you experience changes after consuming papaya, do not disregard them. Bodily changes occur with aging, and new allergies may emerge. 3 digestive complications arise when gut health deteriorates. Papayas are recognized for their digestive advantages due to the enzyme papain. However, for certain seniors, this can be detrimental. Acid reflux and heartburn may worsen as papain increases stomach acid. Additionally, bloating and gas may occur as the enzyme facilitates protein breakdown. Excessive consumption may result in stomach discomfort, cramps, and diarrhea. Individuals with a sensitive stomach or conditions such as IBS may find papaya irritating to their gut lining. If you frequently experience bloating, gas, or discomfort after consuming papaya, it may indicate poor tolerance. Consider eliminating papaya from your diet for a few weeks to assess any improvement in symptoms. If you notice an enhancement in your condition, it may be prudent to avoid papaya altogether or seek safer alternatives for improved digestion. Enhance digestion without associated risks by considering the following options: plain yogurt or kefir, rich in probiotics, which naturally balance gut bacteria; ginger tea, a natural digestive aid that alleviates bloating and nausea; fermented foods such as sauerkraut or kimchi, which supply beneficial bacteria that promote digestion without excessive enzyme activity; and steamed pears or apples, which are more easily digestible than papaya, yet still contribute to gut health. These selections facilitate digestion safely, without interfering with medications or causing adverse reactions. Allergies: 5 strategies to safely consume papaya. If you enjoy papaya and wish to continue its consumption, consider the following precautions. Avoid eating papaya on an empty stomach to mitigate the risk of acid irritation. Limit your intake to small portions. A few bites rather than a full serving can help reduce adverse effects. Consult your physician regarding any medications you are taking, particularly blood thinners, diabetes medications, or antibiotics. Be vigilant for allergic reactions. If you experience tingling, itching, or discomfort, discontinue consumption immediately. In summary, individuals over 65 should approach papaya with caution, as it may not be the miraculous fruit it is often portrayed to be. Seniors should refrain from consuming papaya if they are on blood thinners, diabetes medication, or antibiotics, have a latex allergy, possess sensitive skin, or experience bloating, reflux, or gastrointestinal discomfort. It can be safely consumed in small quantities alongside other foods, provided there are no allergies or digestive concerns, and after consulting with a physician regarding medications. Therefore, consider whether the potential risks of consuming papaya are justified. Your health is influenced by your choices. Food should provide nourishment, joy, and support for thriving, rather than undermine our well-being. However, as we age, our bodies undergo changes that may go unnoticed. What was once a healthy option may no longer be suitable for you today. Consider how many aspects of your life have evolved over the years: your movement, sleep patterns, and even your reactions to certain foods. Yet, many cling to habits out of tradition. The reality is that attuning to your body's signals is paramount. The most significant health decision you will ever make is not rooted in fear, but in wisdom. It involves recognizing that even the foods we have relied upon for years may harbor concealed risks. It is crucial to discern when to implement a minor yet impactful change. Therefore, the next time you select a piece of fruit, take a moment to reflect. Ask yourself whether this choice aligns with the person you are today at this stage of life. Are you consuming this out of habit, or does it genuinely enhance your well-being? Your health is within your control, and each small decision accumulates. The snacks you select and the modifications you make matter. Your application of knowledge is paramount. The objective is not to eschew food, but to make more judicious choices that enable you to maintain strength, mental acuity, and vitality for years to come. If you have reached this point, it is evident that you prioritize your health, which positions you advantageously. I invite you to share your thoughts. What was the most unexpected insight you gained today? Please comment below, as your perspectives may assist others in this community in making more informed decisions. If you found this information beneficial, consider subscribing for further content. Continue to learn collaboratively, as maintaining your health is not contingent upon a singular monumental decision, but rather on the accumulation of little, consistent choices that influence your future. Remain resilient and discerning, and I look forward to our next encounter.